I want to talk to you today about the signs your heart can show during the night while you sleep or as you settle down to rest that are genuinely worth recognizing because the quiet hours have a way of revealing things the busy day conceals. And some of these nighttime signs are among the more telling clues that your heart may be struggling. Because we tend to think of heart problems as something that strikes during exertion or stress in the daytime and rarely think about the night, yet a number of genuine heart-related signs show themselves specifically at night or when you lie down, so understanding these nighttime warning signs calmly and accurately is genuinely worthwhile. So today I want to walk through the main nighttime signs worth knowing. Breathlessness lying flat, waking suddenly breathless, a nighttime cough or wheeze, needing to pass urine repeatedly at night, waking with chest discomfort and awareness of your heartbeat, explaining what each can mean and when it matters, and above all, which are emergencies in partnership with your doctor and emergency services. And I'll keep this calm and balanced because while some of these signs are genuinely important and worth acting on, others are often benign, so understanding the difference lets you respond wisely in partnership with these professionals. This is about recognizing the genuine nighttime signs your heart can show without alarm. Let me start with the first and one of the most telling, breathlessness when you lie flat. The first nighttime sign and one of the most telling is becoming breathless when you lie flat, so that you need to prop up on pillows to breathe comfortably, which doctors call orthopnea. As I've discussed, this happens because lying flat returns and redistributes fluid toward a heart and lungs already struggling in heart failure, while sitting up relieves it. The telling feature is that you've come to need more and more pillows, or to sleep half sitting or in a chair, because lying flatter makes you breathless. This is a genuine, recognized sign of heart failure worth mentioning to your doctor, and it's easy to normalize as merely how you like to sleep, which is exactly why I want you to recognize it. So the first nighttime sign is needing to prop up to breathe because lying flat makes you breathless, a telling sign of heart failure worth mentioning, not normalizing. So breathlessness lying flat is a genuine nighttime heart sign, so heed needing to prop up to breathe. Let me give you the second, which is especially telling, waking suddenly breathless. The second sign is particularly telling, waking up suddenly in the night, an hour or two into sleep, gasping for breath, feeling you need to sit up or get to a window for air, with the breathlessness gradually easing once you're upright. Doctors call this paroxysmal nocturnal dyspnea. As I've discussed, it happens because fluid that pooled in your legs during the day is reabsorbed overnight and overloads a struggling heart while you lie sleeping. This is a genuine and significant sign of heart failure, more specific than many, and it genuinely warrants medical assessment. So if you've woken gasping for air in the night, don't dismiss it, mention it to your doctor. So the second nighttime sign is waking suddenly breathless and gasping, easing on, sitting up, a significant sign of heart failure warranting assessment. So waking, gasping for air is a significant nighttime heart sign. So heed waking suddenly breathless. Let me give you the third, a cough or wheeze that's worse at night or lying down. The third nighttime sign is a cough or a wheeze that's worse when you lie down or during the night, easing when you sit up. As I've discussed, when fluid congests the lungs in heart failure, it can irritate and narrow the airways, causing a cough, often dry, and even a wheeze that can genuinely mimic asthma, historically called cardiac asthma. And this characteristically worsens lying down because that increases the lung congestion. The clue that points toward the heart rather than the chest is the positional timing, worse lying down, better sitting up, and the company of other signs like ankle swelling and breathlessness. Because this can be mistaken for asthma or a chest problem, it warrants proper assessment. So the third nighttime sign is a cough or wheeze worse lying down, and at night easing on sitting up, which can be the heart congesting the lungs and warrants assessment rather than being assumed to be asthma. So a nighttime cough or wheeze worse lying down can be a heart sign. So heed a positional nighttime cough or wheeze. Let me give you the fourth, which surprises people, needing to pass urine repeatedly at night. The fourth sign surprises people because it doesn't seem related to the heart at all, needing to get up to pass urine several times during the night, called nocturia. Now, let me be balanced because this has many common causes unrelated to the heart. In men, often the prostate, plus bladder issues, drinking fluids late, certain medications, including water tablets timed in the evening, diabetes, and simply aging, so it's usually not the heart. But there's a genuine heart connection worth knowing. In heart failure, fluid that accumulated in the legs during the day is reabsorbed when you lie down at night and processed by the kidneys, increasing nighttime urine, so nocturia can be part of the picture, especially alongside the other signs. So while nighttime urination is usually not the heart, it can occasionally be part of a heart failure picture, so it's worth mentioning, particularly with other signs, without assuming the worst. So the fourth nighttime sign is needing to pass urine repeatedly at night, usually benign with many causes, but occasionally part of heart failure, worth mentioning especially with other signs. So nighttime urination is usually benign, but occasionally a heart sign. So mention nocturia, especially with other signs, without alarm. Let me give you the fifth, which is the most serious, waking with chest discomfort. The fifth nighttime sign is the most serious and must be treated differently. Waking with chest discomfort, pain, pressure, or tightness. Chest discomfort at night, particularly if it wakes you, warrants being taken seriously because it can indicate angina or a heart attack. Crucially, chest discomfort that comes on at rest or wakes you from sleep can be a sign of unstable angina or a heart event, which is more concerning than predictable exertional angina. So this is not a sign to note and mention at your next appointment, it's one to act on urgently. Treat chest pain or pressure, especially with breathlessness, sweating, nausea, or pain spreading to the arm, jaw, or back as a possible heart attack, and call emergency services immediately, day or night. So the fifth nighttime sign, waking with chest discomfort, is the most serious and warrants urgent action. Since chest discomfort at rest or waking, you can signal a heart event. So waking with chest discomfort is an emergency sign. So act urgently on nighttime chest discomfort. Let me give you the sixth, which is usually benign, awareness of your heartbeat at night. The sixth sign is one people often notice and worry about, but which is usually benign, becoming aware of your heartbeat or your pulse at night, feeling it pounding in your chest, ears, or head as you lie in the quiet. As I've discussed, this is usually just becoming aware of your normal pulse in the quiet of the night, often against the pillow, and is usually harmless, made more noticeable by quiet, caffeine, or anxiety. However, if you feel a genuinely irregular, racing, or pounding heartbeat, palpitations, especially with breathlessness, chest discomfort, dizziness, or faintness, that's worth mentioning to your doctor. And as I've discussed, an irregular pulse can indicate atrial fibrillation, worth catching. So mere awareness of your normal heartbeat at night is usually benign, while genuine palpitations with other symptoms warrant checking. So the sixth nighttime sign, awareness of your heartbeat, is usually benign, though genuine palpitations, especially with other symptoms, warrant mentioning. So heartbeat awareness at night is usually benign. So distinguish benign awareness from genuine palpitations. Let me help you put these together and tell concerning from benign, because that's the practical heart of this. So let me draw these together because the pattern matters more than any single sign. The nighttime signs that genuinely point toward the heart, especially heart failure, tend to cluster: breathlessness, lying flat, waking breathless, a positional cough or wheeze, and sometimes nighttime urination, often alongside daytime signs like breathlessness on exertion, ankle swelling, fatigue, and rapid weight gain. So it's the combination appearing together and often progressing that should prompt you to see your doctor more than any one sign alone. By contrast, isolated nighttime urination or mere awareness of your heartbeat without the other signs is often benign, and standing apart from all of this, waking with chest discomfort is the one that demands urgent action regardless. So, a cluster of nighttime and daytime heart failure signs warrants seeing your doctor. Isolated benign signs need less concern, and waking with chest discomfort is always urgent. So, the clustering of signs distinguishes concerning from benign, while chest discomfort is always urgent. So, read the pattern and always act on chest discomfort. Let me be clear about what to do because the response should match the sign. So, here's what to do. See your doctor if you notice breathlessness, lying flat, needing more pillows, waking suddenly breathless, a cough or wheeze worse lying down, or nighttime urination, especially clustered together or with daytime signs like ankle swelling, exertional breathlessness, fatigue, or rapid weight gain, since together these can point to heart failure worth diagnosing and treating. Mention genuine palpitations, especially with other symptoms. If you have known heart failure, report new or worsening nighttime signs and follow your monitoring guidance without adjusting medications yourself. Crucially, treat waking with chest pain or pressure, especially with breathlessness, sweating, nausea, or pain spreading to the arm, jaw, or back as a possible heart attack and call emergency services immediately. And as always, treat sudden, severe breathlessness or frothy pink phlegm as emergencies. Don't overworry isolated benign signs like mere heartbeat awareness. So see your doctor for clustered nighttime and daytime signs, report changes if you have heart failure, call emergency services for nighttime chest discomfort, and don't overworry benign signs. So match your response to the sign. So respond per the sign urgently for chest discomfort. Let me paint you a quick picture of how this helps. Picture a man in his 70s who, over some weeks, has been needing an extra pillow to breathe at night, has woken once or twice gasping for air, has a dry cough when he lies down, and is getting up more to pass urine, all of which he's put down to age and a weak bladder, none of it connected in his mind, understanding that these nighttime signs cluster together as a recognized picture of heart failure. He mentions them all to his doctor rather than dismissing them. His doctor recognizes the pattern, assesses him, finds heart failure, and treats it, and as the fluid overload resolves, he can lie flat, sleeps through, his cough settles, and even his nighttime urination improves. Separately, he knows that had he woken with chest pain, that would have been a reason to call emergency services at once, not wait. The same man, but recognizing his clustered nighttime signs, got heart failure caught and treated. That contrast is exactly why recognizing these nighttime signs matters. Let me speak briefly to those of you caring for an older parent or partner. Understand that several genuine heart signs show at night. Breathlessness, lying flat, needing more pillows, waking suddenly breathless and gasping, a cough or wheeze worse lying down, sometimes increased nighttime urination, and most seriously, waking with chest discomfort, while mere awareness of the heartbeat is usually benign. You can help by noticing these, especially when they cluster together or with daytime signs like ankle swelling, exertional breathlessness, and fatigue, and encouraging a loved one to see the doctor rather than dismissing them as age. If they have known heart failure, encourage reporting new nighttime signs and following their plan without adjusting medications. Crucially, treat waking with chest pain or pressure, especially with breathlessness, sweating, or nausea, as a possible heart attack and call emergency services immediately and seek urgent care for sudden severe breathlessness or frothy pink phlegm. Helping a loved one recognize the clustered nighttime signs can get heart failure caught, while knowing chest discomfort is urgent can save their life. So let me draw this all together. The night reveals genuine heart signs the busy day conceals. The telling ones, especially of heart failure, are breathlessness, lying flat, needing to prop up on pillows, waking suddenly breathless and gasping an hour or two into sleep, and a cough or wheeze worse lying down, easing on sitting up, all reflecting fluid overloading the heart when you lie down. Nighttime urination can sometimes join these, though it's usually benign. and mere awareness of your heartbeat is usually benign, though genuine palpitations warrant mentioning. It's the clustering of these signs, often with daytime ankle swelling, exertional breathlessness, fatigue, and rapid weight gain, that should prompt you to see your doctor. And standing apart from all of it, waking with chest discomfort, pain, or pressure is the one that demands urgent action, since chest discomfort at rest or waking you can signal a heart event. So see your doctor for clustered nighttime and daytime signs, report changes if you have heart failure, and call emergency services for nighttime chest discomfort or severe breathlessness. So here's what I'll leave you with, straight and clear. First, know that breathlessness when you lie flat, needing to prop up on more and more pillows or sleep in a chair to breathe is a telling nighttime sign of heart failure worth mentioning rather than normalizing. Second, know that waking suddenly breathless and gasping an hour or two into sleep, easing once you sit up, is a particularly significant sign of heart failure that genuinely warrants assessment. Third, know that a cough or wheeze that's worse lying down and at night easing on sitting up can be the heart congesting the lungs, sometimes mistaken for asthma, and warrants proper assessment. Fourth, know that needing to pass urine repeatedly at night is usually benign with many ordinary causes, but can occasionally be part of a heart failure picture, so it's worth mentioning, especially alongside other signs, while mere awareness of your heartbeat at night is usually benign, though genuine palpitations, especially with breathlessness, chest discomfort, or dizziness, warrant mentioning. And fifth, above all, know that waking with chest discomfort, pain, pressure, or tightness is the most serious nighttime sign and must be treated differently. Since chest discomfort at rest or waking you from sleep can signal unstable angina or a heart attack, treat it, especially with breathlessness, sweating, nausea, or pain spreading to the arm, jaw, or back, as a possible heart attack, and call emergency services immediately, day or night, without waiting, while seeing your doctor for the clustering of the other nighttime and daytime heart failure signs, reporting new nighttime signs, and following your guidance if you have known heart failure without adjusting medications yourself, and not over-worrying isolated benign signs. The night can reveal genuine signs your heart is struggling, so recognizing the telling ones and getting them assessed while acting urgently on chest discomfort can catch and treat heart failure and save your life, which is well worth doing. So take care of yourself, notice the nighttime signs, see your doctor for the clustered ones, and act urgently on nighttime chest discomfort. And because the night reveals genuine heart signs, please treat breathlessness lying flat, waking breathless, a positional cough or wheeze, or these clustered with daytime signs as your reason to see your own physician, and treat waking with chest pain or pressure, especially with breathlessness, sweating, or nausea, as your reason to call emergency services immediately. This touches on nighttime symptoms and sleep, which affect well-being, so if these signs are troubling your nights, please know your doctor can find the cause and help, and in an emergency like chest pain, calling emergency services is always right.